Support for the Living Wisdom podcast is provided by In Touch Pharmaceuticals, a long-term care pharmacy committed to meeting the specialized pharmaceutical needs of their clients. Visit intouchpharma.com. Hey, I'm Karsten alongside Deb Carriveau. This is our Living Wisdom podcast. These are great segments because they're shorter, really dive into the how-to of specific things. And what we're talking about right now is depression. You and I were just chatting that when you have a loved one going through dementia, this is really something a lot of people endure. So how do I know if my loved one is depressed?
Great question. So first of all, I would say that just by the nature of the way a person's brain is impacted by dementia, an underlying dementia or a depression process is very, very common for people who are on this journey. And typically, when we think of what does depression look like, we think about things like social isolation and sadness and people losing motivation and sleeping a lot and maybe withdrawing socially and stop eating and those kinds of things that typically we associate with depression. So although depression symptomology can look like that, what we consider typical in individuals living with dementia, the other side of that is oftentimes how people with dementia processes experience depression is in what we call an agitated depression. Okay. And so it tends to look more like I'm much more irritable, I am more disagreeable, not necessarily with aggression, but just I'm cranky, I'm grumpy. You say it's black, I say it's white, just to disagree. Yeah. I tell people oftentimes the way you can identify it, it's like your loved one got up on the wrong side of the bed today. Yeah. And oftentimes that's how dementia or depression symptomology will appear with someone on a dementia journey. So it's not necessarily always going to look like the typical boo-hoo, I'm so sad kind of depression.
I guess the question though is when you identify that, then what do you do?
So the first thing I would tell people is to not be afraid to get it treated. Okay? In this culture that we're in right now, people have heard so many negative things about medication and clinical treatment for things, and people are afraid of side effects, particularly in the elderly as people age. And one thing I would say is that most antidepressants are very safe. They have very few side effects. We've seen a lot of really good clinical success on reversing, depression that can become kind of incapacitating for people. So seek out, your medical professional. We always recommend that beyond just a general practitioner, kind of family practice physician, if you are working with a neurologist who's following your loved one, or you have a neuropsychologist, those individuals have a lot more specialty and knowledge base specifically related to dementia and medications that can be used very effectively, very safely to treat depression symptomology. The other thing I would want people to know about depression is that if depression is present and it's not adequately treated, it will make an individual's dementia look much more advanced than it is.
Oh, interesting.
So it can actually mask itself to look like a more progressed kind of dementia, when really it's just that kind of underlying depression that's going untreated. And so it makes your individual look like they're much more advanced in the disease than they are. So typically when we're out doing testing and assessment, one of the first things I always screen for is depression symptomology. Because if it's there, we need to get that treated first before we look at and do testing for level of function related to the dementia, because we won't get necessarily a clear or accurate picture.
people are probably sitting at home being like, okay, Deb, you mentioned you come out. How do we get more help? How do we know this?
Yeah.
What are your thoughts if they're looking for a little bit of expert advice?
So if they are looking for that expert advice, if they'd like some help getting the person screened or assessed, just reach out to me and let me know that via email or text. Our contact information is on our site. We would be more than happy to assist people however we can.
Support for the Living Wisdom podcast is provided by In Touch Pharmaceuticals, a long-term care pharmacy committed to meeting the specialized pharmaceutical needs of their clients. Visit intouchpharma.com.